Hello there everyone, it's Linda here from Just for Tummies and welcome to today's live video. And the title of today's video is How to Train in Colon Hydrotherapy. Now this video is going to be streamed live on the Just for Tummies Facebook page, in the Tummy Talk group and on the Just for Tummies YouTube channel. And I will also be sending it out in a newsletter next week. So those of you who receive our newsletters will receive this again next week, and it will also be on the Just for Tummies website in the blogs under the category of health videos. So there are plenty of places where you can view this video. So yes, today I'm delighted to welcome my guest, Roger Gruss, who's the principal of the National College of Colon Hydrotherapy. This is the college where I trained in colon hydrotherapy many years ago. And so I'm going to welcome Roger into the live and let Roger introduce himself and tell us a little bit about his background and why he became so interested in colon hydrotherapy and then wanted to train in colon hydrotherapy. So here we go. Hello, Roger.
Good afternoon, Linda.
Roger, you're moving.
I am, yes.
Just to explain, Roger and I had a little test yesterday just to check our mics and to check that we could hear each other and see each other. And Roger froze. I could hear him, but and I could see him, but it was kind of in stationary mode. So I'm delighted, Roger, that that technical hitch has been resolved.
Yes, indeed. Yes, technology has not beaten us today.
Well, it has me in a way, Roger, because my ring lights that I usually have here have just, they're not working. So I'm a little bit in the dark. So I hope you can see me okay.
I can see you all right. We've got brilliant sunshine streaming in here. So I'm
Roger, I know. Just to let people know that you live in a beautiful part of the country, North Devon, don't you?
I do. I'm very lucky to be here, yes.
And your house overlooks Woolacombe Bay.
That's right.
It's a stunning part of the country. Yes. Okay then, Roger. So I've been wanting to interview you, speak to you for a while about colon hydrotherapy training. It's colon hydrotherapy, as you know, is a great passion of mine. And although I'm no longer in clinical practice, I still do recommend colon hydrotherapy to many people that contact me, particularly those that are struggling with irritable bowel syndrome, bloating, painful trapped gas, constipation, diverticular disease, and a host of other digestive gut disorders, but not necessarily always digestive and gut disorders, because we know that colon hydrotherapy can help with many other conditions as well. Indeed. So if you don't mind introducing yourself, Roger, and just letting people know who you are and a little bit about your holistic background, because I know you've been a holistic therapist for a long time now.
Indeed, yes, well over about 35 years now. Yeah. It's a long time.
I'm 30 years. I've just come up to 30 years.
Right, I've seen a lot of changes as well in that time. Yes. Now, I trained originally, I've got a degree in botany and zoology, and I've always been interested in the natural world. I did my degree at Royal Holloway College at London University in the 70s, and then worked for about 10 years in agriculture as an agronomist, but became rather disillusioned with it in terms of its intensive production. So I retrained, and I was fortunate enough at that time to meet Dr. Milo Seward. So I trained with him in holistic medicine. And then he introduced in 1967, I think, sorry, not 1967, 1987, colonic hydrotherapy training. And he was almost solely responsible for really introducing it into this country at that time. So I trained with him. I must admit, I wasn't particularly interested in colonics at that time, but he said, oh, no, you've got to train in this. It's great. And
was that, sorry, Roger, was colon hydrotherapy part of your holistic therapy training?
No, it was additional to it, actually, additional to it. It was the thing that really captured my imagination about colonics, having then gone into practice, is the fact that it, as you say, it's useful for a number of conditions, what I call functional conditions, IBS and constipation, secondary conditions, especially inflammatory conditions of the skin and joints and things, arthritis, eczema, psoriasis, all these sort of things, where there is a bowel element to it. And thirdly, which is very popular at the moment, the third major group is detoxification. So that's fasting, during fasting, on structured fasts, this sort of thing. It works extremely well for those three main groups. But the thing that really captured my imagination was the fact that you get such good results and so immediately, which of course is the demand nowadays. You know, people don't want to embark on something and be told, oh, in a few months' time or in a year's time, you might see the difference. You actually get the changes on the couch usually. It's quite remarkable.
Yes, yeah, and that's been the you know, when I was in clinical practice as well, the same for me. You know, someone would walk into your treatment room having suffered literally for years, sometimes, Roger, with painful bloating, with constipation, and they looked grey, drawn, and within maybe 20 minutes, as you begin to empty them, you know, the bloating begins to subside, the pain begins to subside, the colour comes back into the cheeks. It's just amazing to see.
It is, and I still find it very satisfying treating people.
Yes, I must admit, I do miss it. I really do miss clinical practice, but I just couldn't do. I had to choose, really, and
there aren't enough hours in the day, are there?
There wasn't enough hours, and you know, we had our first grandchild born as well in February of 2020, and I decided that although I loved colonics, and like you, got a great deal of satisfaction from it. It was time to hang up the nitrile gloves.
Yes. I mean, one thing, I know this is about training, but there's one thing. There are some people who feel very sort of either embarrassed or totally colonics repels them. But it is actually, I've always viewed it as a very conservative treatment, because we're only really using water. We're using water to distend the bowel and stimulate the natural peristalsis that's present in the bowel. So the bowel empties itself. But I think some people get this idea of lots of tubes being inserted into them and pressure washing and things like that. It's not so.
You know what I find, Roger? That a lot of people seem to get confused between colon hydrotherapy and a colonoscopy.
Oh, really?
Oh, I've never found that. I found that, and then when I go on to explain that, no, you know, we're not kind of shoving meters and meters of pipe around your bowel. You know, the speculum just goes in 2.5 inches, and it's warm filtered water that we gently introduce into the bowel under very low gravity.
Indeed, yes, yeah, very low pressure, certainly, yeah.
No pressure. Well, very, very little pressure. I think the pressure, I think actually when someone, correct me if I'm wrong, when someone is having a bowel movement, there's more pressure exerted on the bowel wall than there is when carrying out a colonic treatment.
Indeed, approximately twice the pressure during a normal bowel movement, mass peristaltic movement. So the pressure that's delivered by either a gravity system, which is governed by the height of the tank above the couch, or the pressure regulated machines, is about half of what is generated during a natural bowel movement. Yes, indeed.
I don't know if I ever told you this story, but several years ago, when I was on the committee of the Association of Registered Colon Hydrotherapists, and we'll talk about ARCH a little later.
Yeah.
I went to a health conference with another committee member, and we had a stand there. And we were giving away leaflets, and we were talking about the benefits of colon hydrotherapy. And this lady came up to me, and she said to me, she said, sell colon hydrotherapy to me. She says, because I think it's completely unnatural having a speculum inserted and having water squirted up your back passage. And I said, well, straight away, Roger, you know, the hackles come up the back
Of course.
If anyone, you know, who doesn't have any knowledge of colon hydrotherapy kind of criticizes it, you know, the hackles are there. So I said to her, I said, okay then. I said, well, you know what I find, what I find, well, I went on to explain that I find having to have diseased parts of your bowel removed because of poor management of maybe constipation or other bowel issues, and then having to have, you know, a stoma or a colostomy bag fitted. I mean, to me, I find that strange when such things, if colon hydrotherapy, you know, if they intervened at an earlier stage with colon hydrotherapy, that maybe could have been prevented.
Well, where it's indicated, I mean, yes, it's not a universal panacea, but certainly, you know, the functional bowel conditions and secondary conditions, it's absolutely great. It really is. And as you rightly say, IBS and bloating, it is absolutely magic. It really is. You get the results.
She said afterwards, she says, oh, can I speak to you in private? So I took her around the bike and she said, I wonder if you would be able to help my son, who is at university in London and is suffering terribly with irritable bowel syndrome. So I gave him, you know, the contact details of a colon hydrotherapist in London.
Yes.
Right, okay then. So if you could talk a little bit about the history of colon hydrotherapy, kind of maybe worldwide, just briefly, and then the history, although you've touched on it with Dr. Milo Seward, the history of it in the UK.
Right. Okay. Yes. Yes. Well, colonics is really born out of enemas, and there's a long history of enemas being used on various continents. I think the first recorded use was in one of the Egyptian tombs in Saqqara, where there's a pictogram of a male giving a female an enema on a couch, which is rather interesting. Also in South America, there have been effigies found of parents giving blow enemas to children, and it's well known in the Far East, in Japan and China and in India. And all that tells me that bowel problems have been around for many, many centuries, but it's really, enemas are part of folk medicine. So it's been born out of folk medicine. And where the difference between an enema and a colonic came in was around about the late 1800s, when machines were developed which would deliver water around the whole bowel rather than just the lower bowel. So enemas treat just the lower bowel. You can use a high enema, which does involve a large catheter being inserted, but it still only reaches the splenic flexure, which is just under the ribs on the left side. So they were born out of enemas. Robert Gray in the United States estimated, I don't quite know how he estimated it, but he estimated that one colonic is worth about 30 enemas. So it's very thorough, because we can go right the way around the large bowel, which is anything between 4 to about 10 feet long. It varies in different people, up to the one-way valve, which is the ileocecal valve between the ileum and the cecum. So that's
it's very important, isn't it, to get the water into the cecum if you can.
If we can, yes. If
get that cecum to clear out.
To flush out, yes, indeed.
Yes. A lot of there can be a lot of bacterial activity in the cecum.
That's where most of the activity is, actually. Yes, that's where most of the fermentation happens, in the ascending colon, the cecum, and where the largest concentration of bacteria exist. So that's when it became more colonics rather than enemas, and it was promoted in particular in the United States by one of the Kellogg's at his health retreat there.
That was Battle Creek Sanatorium.
That's right. Yeah, very good film, actually. The Road to Wellville. If anyone wants to watch it, it's well worth watching. It's got Anthony Hopkins.
I've watched it. It's a great film. And is it Anthony Hopkins who played the role of John Harvey Kellogg? Was it John Harvey?
John Harvey Kellogg. Yes. Yeah. I think it was his brother who was responsible for the breakfast cereals, and he was responsible for the health side. He was actually a surgeon as well, so he was well trained. He wasn't a total crank, although he did follow some rather strange religious
Yeah.
um, uh, principles.
But a
Um,
great film. I think Bridget Fonda was in that film as well.
oh, was she? Maybe.
No, not Bridget Fonda. One of the Fonda girls. I can't remember her name now. Anyway, it's a great film. Well worth a watch.
It is. It is. So it was quite popular in the United States and still is. And machine manufacturers tended to be concentrated over there. And it's the machines, I think, that sort of introduced it on a larger scale. But at the same time, there was, strangely enough, an Australian doctor, Dr. Woods, who developed the gravity system, which is something that actually a lot of people use, a lot of therapists use in this country. One, it's inexpensive. Two, there's very little that can go wrong with it. And three, it gives really good results.
Yes, I use the gravity system.
I know you were familiar with that as well. I mean, we actually teach on both pressure regulated machine and the gravity system, but we tend to concentrate on whatever anyone intends to use after qualifying. But Milo was probably mostly responsible for introducing it into this country, as we've already mentioned, and that was the late 80s. Yes. He brought another Helen Woods, just a coincidence, the name, Helen Woods over, who used to teach on that and still is teaching in the United States on gravity systems. She trained the first course, and then Milo took over. And since then, Milo has trained, well, many hundreds of people. Alas, poor Milo, at a good age, died in 2012. But we've continued in his, well, beating the same path, if you like, of training. What we say is we train therapists. We don't train technicians. So we're not interested in so much the machine side, but the therapy side.
Yes. I trained with Milo and with you. I did stage 1 with Milo, stage 2 with you and Anne Bluey. And I don't know if I've mentioned this to you before, Roger, but I tell people this an awful lot, and I write about it as well. But when I went to Milo's clinic to begin my training in stage 1 of colon hydrotherapy, it was such a profound experience, and I knew that I was in exactly the right place at the right time with someone teaching me a discipline that would change my life and change the lives of, thousands of people, tens of thousands of people actually, because Indeed. Without my training in colon hydrotherapy, I went on to establish a very successful clinic.
Yes.
Carrying out colon hydrotherapy treatments, but without that, I wouldn't have had the knowledge to develop my Just for Tummies range of supplements.
Yes, it is educational as well, isn't it? Yes, and seeing lots of different people and lots of different cases to treat, you get well used to it. I mean, that's the very much the naturopathic approach that we use, is that we treat people as individuals. So each treatment is different. You would use different water temperatures, for example. Very important that we introduce the naturopathic use of hydrotherapy and the effect.
Can I just interrupt? Can you just explain exactly what naturopathic means in the context of colon hydrotherapy?
Well, so naturopathy,
technicians earlier, right? Technicians just flush the bowel out, right?
Yeah.
So what is a naturopathic colon hydrotherapist?
Right. Naturopathy is actually a philosophy rather than the practice itself. So it can encompass a lot of different practices, but the philosophy is carried through all of them. And one of the major study areas of classical naturopathy, which was developed sort of Central Europe and formalized around about early to mid 1800s, is hydrotherapy. And there, the hydrotherapeutic effects, so that's the external use of water as well as the internal use of water, are well charted. So you get a lot of effects upon the autonomic nervous system, the blood, the immune system, all the different systems of the body. So we incorporate those into the training, the naturopathic use of water temperature change, length of treatments, time of treatments even. But the philosophy revolves mainly around treating the person as an individual, the fact that nature heals. So we are trying to move the equilibrium within the person towards the healing rather than the illness side.
Yeah.
Obviously, another tenet is do no harm, and doctor as educator. So there are various basic naturopathic tenets that we adhere to and teach during the course.
And colon hydrotherapists, when they're studying at the National College of Colon Hydrotherapy, they're also taught how to incorporate herbs within a treatment, herbal.
Yes, indeed.
Or is that a separate course? I can't remember now, Roger. It's a long time.
No, we've always included it from the beginning, and we still include it. And in fact, although it is no longer included in the National Occupational Standards, which I'll mention a little later, and the core curriculum, we still teach the use of herbs during treatment, and what they do, and for herbs used between treatment orally. And also we teach reflexes, which is something that I've quite fascinated by, the fact that all the parts of the body have different reflexes which link to other parts. Although the bowel is not a particularly a good organ to work on as far as the reflexes go, it does explain a lot of things that happen during treatments.
And of course, manual abdominal massage is an important part of the training and the treatment as well, isn't it?
Yes, it is. Yes, certainly. Yes, and certainly, we always start off treatments by examining the abdomen and palpating and percussing to determine the state of the bowel as it is at that time, and then treat accordingly. But yes, we use massage and we use herbs as well.
I think me being a massage therapist, a remedial massage therapist, when I approached the NCCH for training, then I qualified, and I began to incorporate colon hydrotherapy into my clinical practice. So to me, the massage, the abdominal massage, just kind of came naturally, I suppose. And
yes.
To me, it was a very important part of the treatment, and the actual laying on of hands on a person as well. That contact.
The power of touch, yes.
The power of touch, yes, very important. So just going back to you and Milo then. So Milo trained you in colon hydrotherapy.
Indeed, in 1987. Yeah.
1987. And then you and he decided to set up the National College of Colon Hydrotherapy?
No. It was, I think it was originally in 2003. Sorry, I tell you, 1993. And Blue and I started teaching what we called an advanced course. And we labeled ourselves as the European School of Colon Hydrotherapy. We started teaching down at her premises in Eastbourne, very agreeable down there. And we taught literally postgraduate courses to incorporate, in particular, the naturopathic techniques. Milo taught the basics and we taught the advanced. And that went on for quite a few years. And then in 2003, we amalgamated. So we amalgamated with him. We became the National College of Colon Hydrotherapy and continued up to 2012. Milo taught Module 1. We taught Module 2. And then, of course, we've taken it all on board since, alas, Milo died. But since that time, during the time of NCCH, we've trained well over 600 therapists in colonic hydrotherapy, and we've seen people come and go from the industry. We've seen people retire, etc. But there are still quite a few of the original trainees, myself amongst them, in ARCH, the Association of Registered Colon Hydrotherapists, and it's good to see. It's good to see that.
Yes. So can you explain to people then, Roger, what ARCH, NCCH, the National College of Colon Hydrotherapy, is an accredited colon hydrotherapy training establishment, school?
We are, yes, yeah.
What does that mean exactly?
Well, the schools are
who does the accrediting?
right. Well, the schools are independent, so they're not owned. They're owned. NCCH is owned by myself. There's another accredited school, IPCH, which is owned by Annalise Miller, and we sought accreditation from Arch, which is really the standards body, if you like. They set the standards, and Arch have accredited our courses. And I know Arch feel that their standards are very high. Interestingly, Arch is, I think, one of the only associations which is actually a mutual association. So it's run by members for members. They don't have shareholders. Everyone's a member, and it's the members themselves which over the years have set the standards. So they are set pretty high, which as far as I'm concerned is good, because I think you need capable, highly qualified people carrying out a therapy like this.
Well, it's all down to safety, isn't it? Yes.
It is about safety, yes. Safety
of the client and safety of the therapist as well.
Of course, yes. Well, that certainly is, if you like, underlined by Arch through their hygiene document, their manual of hygiene and good practice, which really gives all the standards that we should be following as far as disinfection, sterilization, use of single-use kits in treating people, this sort of thing. Yeah. So Arch accredit us, and we therefore teach the Arch syllabus, which I think is a very complete syllabus, and I'm sure, and my colleague Annalise does, teach over and above that, because of the fact that we want really good therapists coming out at the end.
Have you had to change the syllabus very much over the years?
The syllabus, not so much, but I'm always updating our manuals, because, for example, in the recent years, the amount of microbiome research going on, and the new things that are coming up every single day, I'm always updating that chapter, certainly. But not particularly. I mean, we use single-use disposable kits. The herb formulae have changed slightly in the years, but the principle is the same, is that we are putting water into the bowel, distending the bowel, stimulating the bowel from natural peristalsis to empty it, and we can work with underactive bowels, overactive bowels, or normal bowels. So there's a whole range of things you can do, different herbs, different temperatures, different diets for this sort of thing.
I'm often contacted by people, through Just for Tummies, who've had a gut infection, like food poisoning, for example, and so they've got diarrhea. And so I always recommend that they seek out the help of a colon hydrotherapist. And I think I know this puzzles them, because they come back to me and say, why would I need a colon hydrotherapy treatment when I've got diarrhea? And I say, well, it's important just to help ensure that the bug, the parasite, is, has been flushed out of your large bowel. But not just that, of course. Arch registered colon hydrotherapists are naturopathic colon hydrotherapists, so they can also give advice and guidance to clear out the small intestine, because the parasite may be in the small intestine, and I would recommend charcoal and maybe some natural antimicrobials as well.
Yes, indeed. Yes, I mean, it depends what parasites are. If they're all the helminths live in the small intestine or associated organs rather than the large bowel. But yes, certainly there's a lot you can do through diet and through herbs, and taking charcoal, diatomaceous earth, etc. You can help at least. But interestingly, diarrhea, we can treat diarrhea, because it's a matter of slowing the bowel down. You can address the bowel function in a number of ways, but it's just as valid by calming the bowel and relaxing spasm, as we do in IBS, for example, than speeding the bowel up and getting it to empty more efficiently.
Yes, yeah. I mean, at the end of the day, diarrhea is just fecal vomiting, isn't it? You know, there's something the body, the brain has picked up that's maybe harmful to the body. So, you know, the bowel or the body wants to get it out, eject it as quickly as possible from the bowel.
Yes. Yeah.
Hence diarrhea.
Yeah.
We've got a question here, Roger. I'm just going to bring it up so everyone can see it. And it's from Tarn. I think Tarn is in Australia, I think. Anyway, is it possible to do part of your course by correspondence, especially the herbs used, etc.? I'm not sure if Tarn is a colon hydrotherapist, actually.
Right. Okay. Well, I can tell you how we structure the course now, and this is really since COVID, which has been a cathartic experience in itself, as far as the teaching goes. Is that yes, I do the theory over Zoom, and they are live Zoom sessions rather than recorded ones, which is required by ARCH anyway, and the regulator, which I'll come on to in a moment. So the theory can be done, and we do that in advance over Zoom sessions. The herbs, yes, they're included in our manuals. When I get a course booking, I always send the manuals out for pre-reading, which always helps a lot. But I can always tell people who've read the manuals when they come on the practicum course. And then we have 8 days of practical course, during which time they'll do an absolute minimum of 15 treatments. I like to do all the treatments that are required. I mean, it can vary. 15 is the minimum. We've just held a course last week where we had 17. And when I was up country a few weeks ago, I think we did something like 25.
And these are people with different bowel conditions.
Oh, yes, that's critical. Yes, yes. So they're all practice clients who we book amongst my own clients and people with bowel problems. So they are real people with real problems. Yes, yes.
So,
I like
so
to mix male and females. Sorry?
Oh, yes, of course, males and females, yes.
Yes.
So you travel to different locations in the country to train in the practical application of the treatment, then, Roger?
Yes, I do some on-site training. It's not that common because I tend to be a rather busy person, and we are certainly very booked up for teaching at the moment. But yes, I will do on-site training as well. And we have trained. Just as a matter of interest, we've trained a fair few Australians, New Zealanders in the past, Danish, Spanish, etc. You know, we've trained internationally, albeit in this country, but they've come over to this country and trained. Yeah.
Okay, right. Thank you very much. Ah, yes. So Tarn is in Perth, Australia. Hi, Tarn. I thought you were. Right,
yeah, lovely place. I bet it's very hot there in the summer, I know.
Oh, and we've got Marjorie here from the island of Curacao. Hi, Marjorie. Thanks for joining us. How lovely. Right, okay then. Let me get rid of that. So, Roger, if you can explain, because it can be quite complicated to someone who maybe is looking to train in colon hydrotherapy when they hit with things like prerequisites, national occupational standards, level 4 anatomy and physiology. So
all of those things, yeah.
Can you just explain if someone approaches you or the National College of Colon Hydrotherapy and they want to train in colon hydrotherapy, what are you looking for in a person, and what do they need to have before you can actually train them in colon hydrotherapy? How does it work?
Right. I think this is all predicated on my conviction that colonics or colon hydrotherapy is an adjunctive therapy. So it goes really well with other things. As a standalone, it's okay. And certainly if you're in a very busy, highly populated place, you can work 100% of the time as a colon hydrotherapist, but it does go particularly well with other therapies. So we train doctors, nurses, and what I call substantial complementary therapists. So they will already have a good knowledge of anatomy and physiology and handling people, if you like.
So they would already be in clinical practice then?
As far as we go, NCCH, the answer is yes.
Okay.
I know different colleges have slightly different prerequisites. So, I would suggest if you look at the IPCH website, it lays those out there as to what Annalise requires. But broadly speaking,
sorry, Roger, the IPCH, what does that stand for again? The
the Institute of Professional Colon Hydrotherapy.
IPCH, yes, okay.
That's right, and they are also accredited by ARCH and teach the ARCH syllabus.
And they're based in London?
In London, yes,
yeah,
yes,
okay.
yes,
yeah.
yes. Sorry, I've lost the thread.
I was saying, if someone approached you and they wanted to train in colon hydrotherapy.
Oh, that's right. Yes. So that's what we prefer. The minimum requirement is they must have a first aid course. So the core curriculum, which is set by one of the regulators of colonics, the CNHC, states that the study time is something just over 380 hours, but that includes at least 120 hours of anatomy and physiology study. Up until
that doesn't include the practicals. That's the theoretical study.
No, that includes practicals as well.
Okay,
that includes theory and practical.
Okay.
But this is again a reflection in my mind of the fact that it's an adjunctive therapy. It's quite amazing that I get quite a few people who will telephone or email and say, "Oh, I'm really interested in training in colonics. I've had colonics myself, but I have no background in medicine." And I'm sorry, but I'm not particularly in favor of training them without something else, another good string to their bow, which should precede training in colonics. That's my personal feeling.
So then would you say, no, you need to go away, you need to train in another complementary therapy discipline that obviously includes level 4 physiology and anatomy, and then come back to us?
Yes, indeed. Yes, and some people have done that. Yes, I have a first contact with people, and then they'll come back. For example, they might study naturopathic nutrition or something like that, and then come back after a couple of years and say, "Okay, I'm done that. I've loved it, and I want to go ahead with colonics." So we have trained some people like that, indeed. Okay. I can always usually give a pathway to prospective students if they so wish.
And what if, say, a nurse approaches you and a nurse wants to train in colon hydrotherapy? Is that slightly different?
Not really. They get the same course. They've got handling skills, they've got practical skills, which, for example, nutritional therapists probably haven't got. So we put more emphasis on the theory with them, and then because their A&P can be a bit rusty at times, but then we get nurse specialists as well. We've had some really good nurse specialists recently who are ex-intensive care or ex-A&E, these sort of nurses, absolutely excellent. And they make very good therapists as well.
And am I right in thinking that if someone approaches you, let's say maybe a counsellor, for example, you wouldn't necessarily take them on straight away. They would have to do some kind of touch therapy before you took them on?
A short massage course is really what's mostly necessary. Again, it's as much the power of touch and the physical side, which is important rather than the speech side, if you like.
Yes. I mean, to be any complementary therapist, including colon hydrotherapy, you've got to be a very good listener. You've got to be able to empathise with people. You've got to be able to be happy to touch people, haven't you? Because
yes, indeed.
Is touching people, and of course you've got to be happy to speak about bums and rectums and feces, and see lots of it.
And I think you need a good sense of humour as well.
Very good sense of humour.
Yes.
Okay. So, is there anything that you want to add to that, Roger?
Well, I have only touched on the National Occupational Standards. They were relatively recently. They were mostly sponsored by ARCH, and they've really formalized the competencies that are necessary to be a colon hydrotherapist. So just to explain, national occupational standards are government backed. They set minimum standards, and it was drawn up in, I think, 2016, 2017 by a government agency called Skills for Health, and adopted by across the industry as the standards to which we teach. And as I said, we teach over and above that, but they are the minimum standards, and they combine with other national occupational standards, which I think are, competencies to be a complementary therapist and this sort of thing, which are generic, basic ones. So we train to that. One thing to mention also is that after graduation, and I'll just explain what it entails very quickly. We do theory over Zooms. We have 8 days practicum, during which there is an external assessment by an ARCH assessor who comes in and assesses the practical ability. And then there is an external exam, which is set by an ARCH examiner, which is then sent off over the interweb for marking. So, and then people have to submit 3 case studies, which will be based on practicals that they've carried out during our practical week. So after assessing all that, they can then qualify. They are then able to apply to join ARCH. ARCH, as a matter of interest, don't regulate their own members. It just doesn't. It was never found to work eventually in the past. So they insist upon external regulation. So they insist upon a number of things. External regulation by either the Complementary and Natural Healthcare Council or the General Naturopathic Council. So you can be join their registers. They also require a first aid certificate, which is just, it's a basic one. So it's first aid at work, E4, emergency first aid at work course.
And then that's taken every two years, is that correct?
Usually 3 years. Usually 3 years, but I think COVID changed things slightly, but we're going back to the 3-yearly basis now. And then lastly, it's a mini CRB, Criminal Record Bureau check, to check you haven't got any relevant convictions that might affect your practice. But the regulation is really...
Speeding fines don't matter, do they? Speeding fines don't matter, do they?
No. But the regulation side is quite important, because it gives confidence to the public in consulting an ARCH therapist, because they know that all these things are being checked out. I mean,
and
I know
insurance, of course, public liability insurance.
Absolutely. I mean, I know ARCH check annually. They check public liability insurance, whether you're registered with an independent regulator, that your first aid is up to date, and that you've completed a minimum of 30 hours continued professional development throughout that year. So that's checked annually.
Yes, that's right. Yes.
So whilst ARCH is the association of members and it's run by members, the schools, IPCH and NCCH, are separate. They are separately owned, but they're accredited by and obviously work closely with ARCH. And ARCH has an education committee which actually sets the standards for education in terms of course content, time, and sets the exams and establishes, appoints the examiners. And the other thing that ARCH do, just to mention quickly, is that we too, the colleges, are also audited. So we're independently audited every 3 years by an ARCH appointed auditor who comes in and checks student satisfaction, whether we're teaching according to the syllabus, all these sort of things. Which is very useful. It's so another check.
It's quite rigorous, isn't it?
Oh yes.
Process. Okay.
Yes.
So we have a question here. Right, from Susie. Will colon hydrotherapy help my neurogenic bowel? Do you want to pick this up, Roger? please?
Yes, I can do, certainly. It really depends where nerve damage has occurred, but I have treated a fair number of people with neurogenic bowel problems, which is either after surgery where nerves have been severed. And it is interesting that the bowel will still work with colon hydrotherapy, because if you think about the bowel, there are a number of nerve inputs. There's the autonomic nerve input, mostly the vagus nerve and the sacral nerves. There's a central nervous system, obviously, which has an effect, but there's also the enteric nerves. And the enteric nerves are responsible for coordinating the peristalsis. And that doesn't disappear because the enteric nerves are a net over the whole GI tract. So the answer is probably it's very good idea to give it a go, because it's quite remarkable where people complain about either not having the urge or not having sufficient nerve input into the bowel. When they're on the couch, you actually see the peristaltic action of their bowel in the tubing. So it can indeed help, and help greatly as well.
I just wonder though, Susie, what your specific symptoms are, because neurogenic bowel, would it be constipation then? Would it be a hypotonic bowel, do you think, Roger, if it's neurogenic?
I would think so, yes, definitely. Yeah.
Yes. And I did email Susie yesterday with your recommendation. You know someone in Cheltenham, don't you? An arch registered therapist.
There is, I'm sure, yes, there is. I think there's at least one, if not two, yes.
So I did pass that information on.
Good.
Okay, let's have a look. Right. So we've covered prerequisites. We've covered national occupational standards. We know what they are. We've covered continuing professional development and first aid. I suppose it's been difficult though, Roger, with the pandemic to, for arch members to maybe keep up to date with their CPD, because there certainly wouldn't have been any face-to-face CPD opportunities that I've always loved to attend.
Yes, indeed. There've been very few face-to-face for many people. I mean, many people have been working from home, obviously. There have been a whole host of webinars. You can probably get a webinar 24 hours a day, a relevant one, on various channels from various parts of the world. So I don't think it's been difficult. It might have been slightly different to normal, but webinars are very useful.
Yes, right. Just let me have a look at my list to see if there are any more questions. So you're busy then with training at the moment?
Very busy, yes.
Is that a recent thing? Because again, obviously, because of the pandemic, I'm assuming you were not busy then.
Well, we did very little training during the pandemic. I think we trained someone in December 2019, and then not again until last year, 2021. But since that time, it's just taken off. I think there's been a sort of a whole host of reasons, but one of them is that there's a head of people who want to train, who are coming through, and there's also the pandemic has given people more focus to change their lives and change the direction they're going in. That's my belief.
I'm sure that's true, because certainly when COVID hit, Just for Tummies, we became very, very busy as people began to make the connection between the gut health and the immune system.
Indeed. Well,
in fact, that was a question that someone asked, actually, Roger. So someone said, if gut health is balanced and healthy, would there be less anxiety and depression? So not about the immune system, but the connection between anxiety and depression and gut health.
Well, yes, I think this is very apparent now with the research on microbiome, is that it's become more than evident that the neurotransmitters that are important for mood are mostly produced in the gut. 80% of serotonin is produced in the gut and 50% of dopamine, very important neurotransmitters. There are lots of other peptides that are produced in the gut as well that act as neurotransmitters. So gut health and mental health go very much hand in hand, or in the same body. That's important. And it's interesting you mentioned the immune response as well, because a lot of immunity resides in the gut, within the lymphatic system within the gut. I mean, 10% of the cells that line the small intestine, the epithelial cells, 10% of them are lymphatic cells. And when you have an infection, those are very, very active.
Yes.
So maintaining a good, healthy digestive system, primarily, I would say, through diet and lifestyle, but secondarily, if it needs help through colonics, is a must for a good immune system and good mental health as well, as you mentioned.
Yeah. I'm sure, I mean, you've been in clinical practice for 35 years, Roger, me for 30 years, and I'm sure you have seen the increase in digestive and gut disorders over those 3 decades.
Yes, yeah. Well, I've certainly seen an increase in the number of people who are willing to come for a colonic hydrotherapy treatment. I think probably diet-related gut or disorders I have seen an increase on, but I think the gut problems have always been there. So either people didn't talk about it, treatment from a conventional point of view was pretty hopeless, all these sort of things. And more people are coming for colonic hydrotherapy now to address their gut problems.
Yes, I just think there's this correlation between drugs and gut health. You know, in particular, antibiotics, antacids like proton pump inhibitors, opioid-based painkillers, and other medication like blood pressure medication, steroids as well.
Yes, yeah. You only have to look in the British National Formulary or see any of the side effects. I'd say probably 80 to 90% of all the pharmaceuticals have gastrointestinal symptoms mentioned in the side effects. Yes. So yes, but fortunately there are fewer antibiotics being prescribed nowadays, which is good news. Because
there's more antibiotics being used in the food in the food chain, in food supply.
Yes, I think those are being gradually limited, thank goodness, because that's a sort of a chronic intake of them, and that is not good. Certainly they've been used traditionally in the poultry industry and I think the pig industry in particular, the pork. But I think that's being largely phased out, certainly within Europe, and I think certainly in this country.
But antibiotics are being not prescribed as frequently as they used to be because, you know, of antibiotic resistance, the rise in antibiotic resistance. Yes. I've seen a rise in the prescribing of proton pump inhibitors like lansoprazole.
Yes, I quite agree. And it's actually it's a terrible situation because ironically, and I know a lot of nutritional therapists think along this line, and I certainly do, is that they're usually prescribed inappropriately because actually stomach acid is probably decreasing rather than increasing with age. Right, yes. And you know, alas, also the PPIs are also prescribed to guard against gastric mucosal damage from the aspirin-based or salicylic acid-based painkillers. Yes. So it's, you know, sort of have this drug and have another one to counteract the side effects.
Yes, that's right. We've got another question here. Where's it gone? Right, I have to move down a little bit. Oh, I've lost it. Yes, educate, Tom. That's right. We do try to educate our clients. Oh, yes, here it is, Roger. Gloria. Hi, Gloria, from the Isle of Wight. Right. I don't think there is a colon hydrotherapist on the Isle of Wight anymore.
Alas, no. The person who used to treat actually emigrated, but has now moved back to the Isle of Wight, but is not practicing. But there will be at some time quite soon, because we are training someone from the Isle of Wight. So they will be available again. At the moment, alas, you have to cross the Solent and go to, I think we've got therapists in, certainly some in Hampshire anyway, Southampton, around the Southampton area. Yeah.
Okay.
Yeah.
And I'm just bringing this up from Jane. Hello to you,
Jane. I
Jane.
know Jane's in sunny Portugal at the moment, I believe.
Yes, and what's she doing on Facebook? Jane, go and enjoy your holiday.
Absolutely.
Right,
I will just mention the importance of colonics during fasting as well, because I've trained quite a few people at retreats, health retreats recently, and a lot of people say, oh, you know, I come for my juices and this sort of thing, but why do I need colonics? It is absolutely essential when you're fasting to maintain elimination, because if you could imagine, you're trying to get rid of a lot of toxic metabolites within the body, and you've got to get them out of the body. You just don't want them recirculating. So colonics are a very good way of ensuring that all waste substances that are being produced when you're fasting get eliminated from the body. And that can be used in conjunction with all sorts of other things, skin brushing for lymphatic circulation, rebounding, enjoy some nice massages, some nice saunas, all these sort of things help elimination through the skin, through the lungs, through the bowel, and through the urine.
I know when I went to the Viva May Clinic of Modern Medicine in Austria, and I did some fasting there, that, you know, colon hydrotherapy was an important part of the regime, as was saunas, skin brushing, massages, liver packs using castor oil, liver packs. And what else? Some gentle exercise, but not too much if you're fasting, obviously. But I think some people think, oh, you know, I'm fasting, therefore I'm not going to be producing a lot of stool. But it's not just about getting rid of the stool, is it, when you fast?
No, it isn't. No. Although the fasts, most of the retreats that I know use what I call the modified Jensen fast, which is using psyllium husk, bentonite clay water, as well as vegetable juices, and that sort of sets and pulls stuff out of the small intestine, which is the part we can't usually reach. So it comes out, and that's what you need to get out of people. It scrubs the small intestine, actually absorbs the toxins and goes out of the body, and that works very well.
And of course, colon hydrotherapy, although the colon hydrotherapy treatment acts on the large bowel, I think you get a secondary effect in the small bowel and the small intestine as well, because once you've released whatever is building up in the large bowel, then everything can make its way through from the small intestine too.
Yes, and also the fact that the whole gut is what's called a reflexive organ. So what's happening in one part affects the other parts. So, you know, this explains why most people defecate in the morning. After breakfast is a traditional time, because you've got the maximum peristaltic action in the lower bowel at that time, which is the orthocolic reflex combined with the gastrocolic reflex. So anytime you put anything into the stomach, it sends a message down to the bowel via the nerves. There's something coming, start to churn around, and it works in reverse. So, you know, when we're stimulating the bowel peristalsis, that sends a message up to the stomach and up to the rest of the intestines, you know, that something's happening, and it will affect those parts as well. Yes.
Last week, I had 2 emails from 2 different people, one from a lady and one from a gentleman, Roger, who were both struggling with breathing difficulties.
Yep.
And both suffered with very, severe bloating, abdominal bloating. One who went to see a gastroenterologist was told that it was, and this was the lady, she was also getting palpitations.
Yes.
And the gastroenterologist explained to her that there was nothing wrong with her heart, that the problem was with her gut, with the bloating. So, as you know, we've got around 23 feet of intestines there, and they can stretch and expand an awful lot, not just anteriorly outwards, but upwards into the diaphragm, and affect anything that's in the chest cavity, including the lungs and the heart.
Yes, 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 indeed. Yes, yes. I know certainly asthmatics as well always say that they can breathe much more easily after a colonic. It's just about reducing the intra-abdominal pressure. If you reduce the pressure within the abdomen, then you enable the diaphragm to move much more easily, but you also have great influence upon the bladder as well. So it's really useful for bladder problems like interstitial cystitis and these sort of things. Had some very, very good results with that, because you're basically reducing the pressure so the bladder can then have a greater volume and
Yes.
This sort of thing. And you see this on the couch so abundantly, where you get someone coming in who's rather pained and bloated. On the couch, you get loads of gas out of them as well as feces, and you get them to feel their abdomen. They say, "Oh, crikey, my skirts will fit now," and all this sort of thing.
I know.
And they're much happier, feel much more comfortable.
But this is a particular interest to me, Roger. Interstitial cystitis, urinary tract infections in particular, and the connection between an increased risk of UTIs and constipation. Because if a woman is constipated, I know men get cystitis as well, but more women get cystitis.
Indeed, yes.
If a woman is constipated, then the constipated bowel can put pressure on the bladder, and so it doesn't empty as well as it. So you've got retained urine with that E. coli bacteria, and so you're at an increased risk of getting another UTI.
Yes, indeed. Yes. Well, of course, in females, the urethra is more likely to get contaminated with coliform bacteria from the bowel, and
because it's closer to the bowel, isn't it? Anatomically, it's closer to the bowel. It's shorter.
Absolutely, which is why more females suffer from cystitis, infectious cystitis, than males, and also. There is more likely after pregnancy to have slight prolapse or something like that. So you get the bowel sagging onto the top of the bladder. So yes, it can have a profound effect. And certainly I've had very good results in treating females with recurrent cystitis.
I don't know if I ever told you this story, Roger, probably not. But when I was still in clinical practice, and I'm going back about 8 years now, this lady was referred to me by her gastroenterologist.
Yes.
Because she suffered with chronic constipation, and they tried every laxative, they tried enemas, and nothing had worked. And so the only other thing that was left to them was manual bowel evacuation.
Oh, which is very unpleasant. Yes.
Very unpleasant, and they wouldn't do it on this particular lady because she was antibiotic resistant.
Right.
So the only way we could resolve her constipation was with colon hydrotherapy. But I was intrigued as to why she'd become antibiotic resistant. And it's because she'd had a history, many years of UTIs, urinary tract infections. Right. So each UTI that she had a course of antibiotics.
Right.
Become antibiotic resistant, and I'm sure the antibiotics had also maybe affected transit time in a bowel, and so caused the constipation. I can't be sure about that.
And the microbiome, yes.
Well, yes, but the colon hydrotherapy, it took 3 treatments to. After the first treatment, she felt relieved, but it took 3 treatments to completely empty her out, and then that's what made me go on to develop my For Women probiotic capsules,
right.
to try and get in early when a woman, if she has her first UTI, right, to try and get in early with some probiotic support.
Yes.
To prevent her from getting another UTI. And obviously diet comes into it, and lifestyle as well. I have a fact sheet all about how to prevent UTIs.
Absolutely. Well, that's one thing we do teach on the course, is the importance of diet. And one thing that we do cover thoroughly is fiber, because not all fiber is the same. Wow. So that's something that I'm quite passionate about. Wow. And now there's a lot more emphasis put on fiber and the prebiotic nature of fiber than there has been in the past, which is really important.
Some people are afraid to take fiber, to eat more fiber, or even to take any kind of fiber supplement, because they think it's going to block them up.
Yes, yes.
And it can do, Roger. You know, it can do, can't it? Especially if
It
it's not
can for some people, yes. Yes. Yeah. But I mean, certainly fiber is really useful for people who have hard stool and who are constipated, because they need to retain more water. And I mean, the ideal stool is one that's soft and easy to pass, but formed. Um, and that's particularly important for people with diverticulosis and hemorrhoids, and who are constipated. So they need more fiber to lock the water in, and adequate hydration as well to keep them regular.
Yes. I received another email. I get lots of emails. This was yesterday from a lady who thought she had hemorrhoids. She went to see her GP 3 times and was told that she had hemorrhoids and was given cream. She eventually went private to get these hemorrhoids checked out, and it transpired that she'd got rectal cancer.
Right. There's a lot more cases of anal and rectal cancer nowadays occurring. No one's quite sure why, but the incidence is climbing a lot, which is again something we obviously teach the red flags on the course, and this would be one of the things. And one thing that I always emphasize to students is, the first time you treat anyone, you must do what's called a DRE, which is a digital rectal exam, because you need to know you need various data from that. You need to know the position of the anus, the direction of insertion, and whether there are any hemorrhoids or other things detectable inside the anus or around the periphery.
Yes, it's very important. I remember a few years ago, a young man came to me for colon hydrotherapy treatment. He was in his late 20s. He didn't want to be in my treatment room, Roger. It's the last place he wanted to be.
Yeah.
But his girlfriend, who came to me for treatment, suggested he come along and have colon hydrotherapy, because he suffered with constipation. And he'd had constipation for quite a few weeks, and he'd been to see a GP a few times, been prescribed different laxatives, told to eat more fiber, but nothing was happening. So he came to me, and of course I did a digital rectal examination, and it was very bloated and in a lot of discomfort. And he was just passing a few tiny hard pieces of stool. So I got him onto his left side. I put the glove on, the nitrile glove on, did the DRE, and I could feel something just inside his rectum, a small nodule. And when I pulled my finger out, there was blood on the glove. And I thought, well, I'm not going to say anything to him at this stage. I didn't want him to freak out. And I inserted the speculum, and he was very comfortable with the speculum insertion. I got him onto his back, and then I turned the water on. And I just introduced it, because he was so bloated and so uncomfortable, warm water, very, very gentle, very conservative to begin with. But, I could not get any water into him. It just kept coming straight back out. And he kept saying to me, is anything coming out? He was desperate for something to be released. Is anything coming out yet? Is anything coming out yet? And I carried on for about, and Roger, as soon as you turn the water on and you get the warm water in there, within a matter of minutes, if you're not getting any stool out, any solid waste out, you're getting some gas out, and the bloating begins to subside, doesn't it? It doesn't take very long, but nothing was happening at all, and the water just kept running out. So I said, I'm sorry, I'm just going to have to abandon this treatment, and whilst you get interest, I'm going to type up a quick letter, and I want you to go straight down to the hospital, to A&E, and give them this letter, and let me know how you get on. Give me a ring this afternoon. Anyway, he did ring me later on that afternoon, and he said, I'm waiting for an X-ray. They've referred me for an abdominal scan. And then I didn't hear anything else until the following day, when his girlfriend rang me to say that he'd been diagnosed with advanced rectal cancer. And he was 29, I think. He was very young. And he never came out of hospital, Roger.
Really?
That was in the February, and he died in the April.
Crikey, yes, very advanced, and
very advanced
stage.
So young. Yeah.
I mean, certainly if we ever see blood during a treatment, either from a DRE or during the treatment, it is a red flag. People need to get that checked out.
Yes,
As
and,
you might be
if had the colonic been quite normal, I would have still said you need to go back to your GP because this is
absolutely,
what I've
absolutely.
seen. But in any event, I kind of bypassed the GP and sent him straight down to the hospital.
Yes,
Because
yes.
in carrying out many thousands of colon hydrotherapy treatments, Roger, I had never experienced one where the water just wouldn't go in. So there was obviously some kind of obstruction there.
Absolutely.
And had it have been stool, again, as you know, had it have been hard impacted stool, eventually the water finds a way through the cracks.
Indeed.
And it acts as a solvent, doesn't it? And it begins to soften that hardened feces, and then it can be released. But that just wasn't happening in this case.
Yes. Alas, the incidence of colorectal carcinoma is increasing with young people as well. Definitely.
I've read the research.
Definitely. Yeah. And again, who knows? Is it diet related? Probably, because our diets now, especially fast food, is terribly contaminated and really, devoid of a lot of nutrients. Yes, dead.
Food, isn't it?
It is dead.
Hardly any, nutritional value there. Yes, diet, and the environment, pollution, as you say.
Yeah.
Yes, I'm sure there are lots of factors. Maybe family history too. Family history of not just colorectal cancer, but maybe colitis, Crohn's disease.
Yes, colitis of Crohn's is a bit of a mystery as to no one really knows what causes it, but a lot of work's going on with the microbiome. But it's always difficult to tell whether it's chicken or egg. Is it the microbiome that causes the Crohn's or inflammatory bowel disease, or is it the inflammatory bowel disease that changes the microbiome? No one really knows yet. A lot more work's got to be done. But certainly, one thing we haven't mentioned at all is I'm quite interested in it, although I don't do it myself. Or practice it myself, but fecal microbial transplantation has been really found quite promising for ulcerative colitis, and it makes sense to me, because whilst probiotics you can deliver, I don't know, 4 to 20 strains, with fecal microbial transplantation you're delivering a nucleus of probably many hundreds of strains of bacteria and viruses, which are bacteriophages mainly, and archaea, from a healthy person into a diseased person, if you like.
Yes.
And results have been very, very good. I mean, you look, it's only recommended for
Clostridium difficile, isn't it?
Clostridium difficile treatment, but people are looking at it in other fields, and certainly for in ulcerative colitis in particular, it's looking very promising. So it does tend to suggest ulcerative colitis is something to do with the microbiome, but Crohn's is rather different, and it's a nasty disease as well. Crohn's is.
Yes, more sort of autoimmune, really. Autoimmune disease.
Probably, yes. It affects all the gut as well, not just the large bowel. Yeah.
Yes, yeah. and other parts of the body, like the eyes, the kidneys,
the mouth. Yes.
It's systemic. It's in the blood, isn't it?
Yes.
It's just localized to the large bowel.
Yes, indeed. Yes. Yeah.
Just before you go, Roger, can you just talk a little bit about diverticular disease and diverticulitis when it comes to colon hydrotherapy treatment? Because I get many inquiries from people who I think it's very poorly managed in primary and secondary care diverticular disease. I think there's a lot can be done to intercept before someone gets a nasty diverticulitis flare up, but that's a story for another day. But when it comes to colon hydrotherapy, can a person have colon hydrotherapy treatment when they have diverticular disease?
Right. Okay, diverticular disease is quite interesting because most people don't know they've got it until they get a flare up of diverticulitis.
Or they have a colonoscopy for something else, yes.
Indeed, yes. So diverticuli are little pockets which tend to be more towards the end of the bowel, so the descending sigmoid area, but they can indeed be right the way around. And they're thought to be, well, they are age related. So the older you are, the more likely you are to have them. It could be something to do with aging and the fact that collagen, when we age, doesn't cross-link so strongly. So in the same way you get sort of wrinkles on the skin, you get weaker tissue within the organs of the body.
Yeah.
And it's certainly linked to constipation, where you get increased pressure within the bowel. So the bowel peristalsis is pushing against the stool and causing these pockets to develop. So if they're latent, so you're not getting any symptoms, it's called diverticulosis. If they're inflamed, and the sort of symptoms you get with inflamed diverticuli are dull, persistent pain. So it's the persistent pains are the ones that are much more significant than the ones
in the left-hand side, the lower left-hand side of the abdomen.
The left-hand side, principally, yes. I mean, classically, it's dull left-hand sided persistent pain. But it can be across the waist as well. Yeah. So the thing with diverticulitis is to avoid it is to keep the stool soft and easy to pass. Mm-hmm. So fiber is important. You can certainly use some herbs. There's a pretty specific herb for diverticulosis or diverticulitis, which is fenugreek seed powder. The powdered herb acts as a mucilage, so it lubricates things.
Fenugreek seed powder.
Fenugreek seed powder. It must be powdered.
Do you sell that from your apothecary?
I do to my clients, but not otherwise. But it's.
No, I mean, if I referred someone to you for this powder, you'll be able to help them out with it.
Oh well, I don't know why Just for Tummies don't formulate something with fenugreek seed powder, maybe a bit of slippery elm if it ever comes down in price.
Yeah, just giving me more work to do, Roger.
Yeah, absolutely, yes.
In encapsulated form, then.
Yeah, you can take it loose, or you can take it encapsulated. I mean, you should be able to buy it. It's a culinary herb anyway, so as long as it's powdered. There's one thing with diverticulitis that I always say, or diverticulosis, is avoid sharp seeds and nuts, because they do get stuck in the diverticuli and they irritate them, and that even applies to linseed. So ground linseed.
Yes,
that's very
interesting. That's very interesting, Roger, because I had an email from a gentleman yesterday who's just been diagnosed with diverticular disease, and he was advised. I don't know. It was whoever carried out the colonoscopy. So I think the endoscopist. Sometimes you'll get a gastroenterologist, won't you? But whoever it was, the technician, advised him to take linseeds. Right,
they must be ground, not whole.
Yes.
Absolutely. The linseeds, I think, are some of the worst, because if you think of them, although they have a mucilage that they secrete, when they're soaked, they're very sharp seeds. They are. Grind them up. That is absolutely fine.
So just going back, sorry, to my question then about colon hydrotherapy and diverticulitis. My understanding is, yes, they are able to have a colonic, providing they've not had a diverticulitis flare up for, is it 6 months?
Something like that, yes, indeed, absolutely. In fact, diverticulosis is an indication, diverticulitis is a contraindication, and if it's very recent, certainly within 3 to 6 months, I'd leave it for some time, but work just on diet.
But colonics, of course, because if the colon hydrotherapist is not able to carry out the colon hydrotherapy treatment on that person, then because they are naturopathic colon hydrotherapists, they can give other suggestions and advice, dietary, lifestyle, to avoid getting these unpleasant flare-ups.
Absolutely, yes. I mean, nutrition is quite an important part of our course, and certainly an important part of the syllabus. So they've got therapists, if they haven't trained already, if they're not already nutritional therapists, will have to understand how we digest different, fats, proteins, carbs, the significance of some of the vitamins and minerals that we have in the diet, and to be able to prescribe various diets accordingly. So one of the things that we teach the food combining diet. We cover a number of dietary protocols, the Candida diet, the yeast control diet, these sort of things, and IBS diets. And these are some of the ones I incorporate in the manual, the ones that I devised about 20 odd years ago to give to my clients post colonics.
Oh, those manuals. I thought you were talking about these manuals.
Yeah, those manuals. Good
the
heavens.
Manuals that I still have, yes.
Yes, yeah, the course manuals.
So you give out fact sheets and support sheets to your clients then?
Oh yes. Oh yes, absolutely. I mean, it's not just come and have a colonic and go away again. There's an aftercare sheet anyway, general aftercare sheet, and then there are specific recommendations which I will write down for them. So they're dietary recommendations or herbal recommendations or lifestyle recommendations. And one of the most common ones that I'm sure you'll be able to recognize, Linda, is eat slowly, chew food well, because when we're doing colon hydrotherapy treatments and you see what's coming out, you see food that is just not digested, that obviously has not been chewed. Yes. So, this is often the reason why I'd say the sort of the type A people who are more likely to be the IBS sufferers get such bad fermentation, because their food, undigested food, is passing down into the bowel, and their bowel bacteria are partying all the time. They're just having a wonderful time carrying on the digestion. And it's interesting. I mean, I don't think this was known until a few years ago, but we can get up to 18% of our energy through bacterial fermentation of food in our large bowel, which is an enormous amount. Yeah.
Well, there's that old saying, drink your food and eat your drink. So don't swallow your food until it's been well masticated and there's plenty of saliva and enzymes mixed in with it. Then swallow. And the same with drink. Just pop it in your mouth, swish it around for a few seconds, and then swallow it.
Yes, indeed. Yeah.
Right. Well. Oh, by the way, the fenugreek seed powder, that's one of the ingredients in my own tummy tea, my recipe tummy tea. Together with ginger root, licorice root, cardamom seed, aniseed, black peppercorns, and fennel seed powder.
Good. Well, it has a mild, fenugreek seed has a mild curry flavour, so it sounds as though you've got the makings of a good curried capsule there.
It does taste delicious, if I do say so myself.
Okay.
Right, I can't think of any other questions I need to ask you, Roger, unless there's something important that you think I've forgotten regarding training.
No, I don't think so. I think what I would say is, if you're interested, or any of your viewers, Just for Tummy's viewers, are interested in training, look at our website. So look at the Arch website first for the accredited courses. You can look at ours, which is www.ncch.co.uk, or you can look at Annalise's, which is www.ipch.co.uk.
I'll put all those links above this video, Roger, when we finish, and then people can have a look. And if they've got any questions, they can contact you. But like I say, it will be on the Just for Tummies YouTube channel. It will be on the website under health videos, and I'm going to be sending it out next week in a newsletter as well. So I'd just like to, we've been talking longer than I thought we would, Roger. I love a good conversation about colon hydrotherapy.
Good chat.
I've thoroughly enjoyed it. And, I have to say to people that my training as a colon hydrotherapist, and when I was in clinical practice and when I was doing all my CPDs and attending the conferences, in terms of my professional life, they were the best times of my life.
Yes. I mean, some of the reviews we get for our courses are absolutely amazing. I mean, I had one recently. I'd do it all over again. It was great. I thoroughly enjoyed it. And some people said, best course I've ever been on, because it's so practical, as well as the theory is really interesting and engaging. And I think probably the teaching methods we use are also inspirational. But the good thing is you come out at the end of a relatively short adjunctive course with a qualification. And that qualification enables you to get professional indemnity insurance. You can join a good association in Arch, and you can practice. And with colonics, you can actually make a living.
Well, you can. A pretty decent living, yes, yes.
Yeah,
Well,
unlike sort of massage and reflexology, where there are many, many hundreds of people all vying for the same thing. You know, you have
yes.
to be the very
Yeah,
best.
I've got to say at the moment, colon hydrotherapists are as rare as hen's teeth, aren't they? But
They
you know,
are. They are.
people,
It's quite.
I would travel miles and miles, you know, to see a good colon hydrotherapist. That's me. Luckily, I don't have to travel very far because Jamie's just down the road. But like I say, it certainly changed my life and changed the lives for the better of many of my clients that came to see me. And as you said when we first started speaking, Roger, the results are just almost instantaneous. In
They
one
are.
treatment, you can relieve someone of the most debilitating pain and bloating that they've been suffering with for years.
Indeed. Indeed.
So I would like to thank you very, very much for giving up your precious time today and talking to me. It's been wonderful, and I will let you get back to your vegetable patch.
Thank you very much. It's been a pleasure talking and chatting with you, Linda.
Thank you so much, Roger. Bye-bye.
Bye bye for now. Bye bye.